age-related macular degeneration is the leading cause of visual loss in the elderly. Although we have treatments for advanced form of AMD, although we don't have for the early forms of AMD, especially patients with a large drusen, we know they are at risk of developing advanced AMD, and we have so far no treatment. Thanks to the photobiomodulation paradigm and what we call low-level light therapy, we can now deliver a treatment for those patients with these early forms of the AMD, and especially patients with drusen. Of course, this new therapeutic modality is not already recommended and not already properly assessed, but we are contacting with several countries in Europe with this machine from the expansionate group. We are conducting a multi-center randomized control trial to assess whether this photobiomodulation process can alter the disease progression, and we hope so. So see you soon in the future.
Hello everyone, it's Claudio speaking. I work as a researcher at Babylon University of Naples, Italy. I am so glad to talk to you about our recent ongoing randomized sham-controlled clinical trial about PBM in patients with dry AMD stage 2 and 3 according to the AREDS classification. All patients will be randomized with a 1-to-1 ratio of PBM to sham, and patients receiving treatments will receive 2 cycles of treatment, the first one of which include 8 sessions twice a week for 4 weeks. And after 4 or 6 months, they will receive the second cycle, including up to 6 sessions. All patients will undergo a complete ophthalmic evaluation with best-corrected visual acuity measurements, contrast sensitivity, microperimetry, and multimodal imaging evaluation, including OCT, where we will measure all the drusen volume in the macular area. All these parameters will be measured and compared from the baseline to the 6 months follow-up. Stay tuned because we will show you our interesting results in the next few months.
Low-level light therapy is a unique near-infrared light-based photobiomodulation technology. It is completely painless for the patient, yet extremely effective in managing a wide range of macular conditions, from the front to the back of the eye. Different wavelengths, red, blue, and yellow, are available for treating different cases. And level D works at the biological level, generating endogenous heat from powerfulness, stimulating the ATP production in the cells. The simplicity offered by the technology to the operator, combined with the efficacy in treating most ocular disease, make it a really true game-changer procedure.
My name is Sarah Farrant. I'm one of the optometrists based here at Christopher in Taunton. We've been working with the photobiomodulation unit here in terms of treating dry macular degeneration for a number of months. The application is very simple. You go through 2 phases of the mask therapy, the yellow followed by a red. And basically the mask is worn for 6 minutes of total, 5 minutes of which is a continuous light, and then the final minute is a pulse light. During the procedure, the patient keeps their eyes closed for the continuous light part, and then they open their eyes whilst the light is lasting a minute of the procedure. Sally, you had a number of treatments with the mask now. What's your experience in practice of actually having the treatment in the clinic here?
But no, nice to be easy and convenient. The mask is less comfortable. The light's not too bright, and in fact, it's quite relaxing, really. Sitting there having that sound, I'm very happy with it. It's been great.
So, to show you how we actually work with next, I'm going to be closing eyes for me. So, place the mask over the head.
Yeah.
And then we start the cycle whereby we escape the light with a closed-eye environment. That lasts for 5 minutes. And then, as I mentioned earlier, when the light starts to pulse, the patient opens their eyes for the final minute of the treatment. Simple as that.